The United States is the only modern country in the world, including China and Russia, that doesn't have a national health care plan. Our healthcare system is based on profit rather than the welfare of our citizens. 48,000 people die in the U.S. each year because they can't afford healthcare, and our average lifespan of 78 years is 50th among 221 nations. We also rank last in the quality of healthcare compared to similar civilized countries. High deductibles, co-payments, and out-of-pocket costs force insured people in the U.S. to struggle to pay for required healthcare. We spend more on healthcare per capita than any other modern nation, and we rank 46th among the 48 countries with the most efficient healthcare systems. So, why are healthcare costs so high in the United States? The AMA commissioned the Flexner Report in 1910, which stated substandard medical schools were supplying second-rate doctors. They convinced Congress to shut down what they considered to be substandard medical schools. This drastically reduced the supply of doctors by almost 30% over the next 30 years. This decision resulted in a massive shortage of physicians. U.S. doctors charge twice as much as their European colleagues, which is one key reason for the high healthcare costs in America. Doctors claim that malpractice insurance is the reason for the high cost of healthcare. But in reality, its premiums amount to well under 1% of the total U.S. healthcare bill.
How much do y'all think I pay for medical malpractice each year? 40,000? 60. Anyone want to shout out the number for me?
$3,048.46.48.
Most doctors don't pay a whole lot more than I do. Surgeons pay about $18,000 a year, orthopedic $20,000 a year. They can afford it though. They make a lot more than I do. And certainly I don't think most people guess that my medical malpractice is 1/6 the price of our health care insurance.
Hospital charges represent about 1/3 of the annual United States healthcare bill and cost on average 5 times more than any other civilized country. They use a price list called the Charge Master, and almost everything is irrationally priced. A penny aspirin could cost you upwards of $20 in a hospital setting. Prescription drug prices in the U.S. are 5 to 117% higher compared to other countries. The pharmaceutical industry claims that the reason the price of their drugs are so high is because of the research and development costs of their new products. But BMJ, a medical journal based in London, stated, for every dollar a pharmaceutical company spends on basic research, $19 goes toward promotion and marketing. Big Pharma could easily cut their prices significantly without affecting their research and development programs in any way. The U.S. is the only highly developed country that does not regulate drug costs in some way. Governments in other countries take advantage of their bargaining power to negotiate prices with drug companies. Why won't our government representatives negotiate with big drug companies on our behalf? The U.S. Congress, who write the laws that are supposed to protect us, are bought and paid for by the special interest groups who represent the pharmaceutical industry. And that leads us to one of the biggest scams ever perpetrated on the American public: healthcare insurance. Until the Affordable Care Act was passed in 2010, health insurance companies could refuse to accept anyone because of a pre-existing health condition. If you made an honest mistake on your insurance application, they could cancel your benefits and declare your policy invalid from the day it began. They could set a dollar limit on their yearly spending and a lifetime limit for your covered benefits. Insurers are now required to cover certain preventive services at no cost to you and must make coverage available to children up to age 26. The for-profit healthcare insurance company's goal is to collect as many premiums as possible while paying out the least amount of claims. A person having paid premiums for years could suddenly discover that the low-priced insurance that they were paying bargain rates for wasn't worth the paper it was written on. The healthcare insurance company's greed has cost thousands of patients their lives because they could not get life-saving medical services. As long as our healthcare system is based on profit, Americans will never be secure in their health needs. We need universal health care, just like every other civilized country in the world has.